talk about telemedicine in COVID-19 at Taiwan, the good and what to update. So this is a definition by WHO, but it seems really hard to understand, right? So in brief, telemedicine is an approach of using technology to deliver medical services and long-term care without considering the distance. Also, telemedicine can be used for the continued education for the health providers. So what can telemedicine do? So first, telemedicine can provide clinical services. Second, it can break the geographical barriers. And third, it can use various types of technology to deliver medical care and long-term services. And lastly, can outcome our health issues. So why did Taiwan took effective measures so early? I will say the answer these two experiences. In 2001, SARS caused nearly 1,000 people die due to a lack of personal hygiene resources. Also, in 1991 earthquake, the medical system collapsed in the disastrous areas. Therefore, in order to prevent the tragedies happening again, Taiwan government implemented quarantine measures earlier, minimized the community infections, and also avoid the lack of the personal hygiene resources. And then, in order to solve the daily health issue during the quarantine period, Taiwan authorities use telemedicine for the mutual communications. So, before I talk about how we use telemedicine in the COVID-19, I want to talk about the history first. So, originally, telemedicine is used for the remote areas due to the inability to setting up the family doctor systems. The National Information Infrastructure first promoted telemedicine in 1994 and highly expanded in the 1991 earthquake to reconstruct the medical system. Some national hospitals, like National Taiwan University Hospitals and National Changkong University Hospitals, have joined together to develop outpatient systems, which include the online registration, electronic medical records, and also the medical imaging functions. So how does Taiwan use telemedicine in COVID-19? So telemedicine in Taiwan is mostly used for the people infected with COVID-19 or people undergoing the quarantine measures. Also, in order to minimize unnecessary hospital visits, Taiwan used telemedicine for the hospital visits, and also this reduced the medical teams and other patients to be exposed to contagious areas. And the approach of Taiwan using telemedicine is reliable due to its abilities and accessibility among all patients and doctors. So, however, there are still a few things that we need to update. First, we cannot use telemedicine independently, which means we have to integrate with local hospitals, and this may reduce the urgent needs. And second is that telemedicine has been limited to the COVID-19 patients. However, turning to the US, they have been fully developed into telehealth. So you may wonder, so what is telehealth? So telehealth is really similar to telemedicine, but telehealth involves a various types of the medical system care, involving clinical services and non-clinical services, like physical conducting or the administrative meetings. However, turning to telemedicine, it's only being used for clinical services. So how does it work in the US? So in this diagram, we can show that you use the telephone or your FaceTiming and contact your doctors, and then you can show him or her your blood rate or blood sugar, and even conducting a physical check. And then the doctor can give you the most related options and even a diagnosis. In the US, they have accelerated and developed the health IT since 2004. And today, over 35 states have even declared laws to require insurance to cover up the telehealth. And in this graph, you can know that more than 76% of the hospitals in the United States have used telemedicine for the approach of giving the health care, which is 2 times more in only 7 years. So what is good about telehealth? So first, we can use it independently. Second, less cost and time needed. And third, we can still receive the professional medical care and long-term care. In the US, there's even a specific unit to cover and handle the those medical teams for the telehealth, which means they can provide the most related options among all patients. As for doctors, they can give the diagnosis directly, conducting physical checks without integrating with local hospitals. Since the US is so big and they don't have the public health insurance, taking the medical fees can be really hard and not everyone can receive it. However, while using a telehealth, with only a few bucks and the internet, you can receive the medical assistant care and long-term care immediately. So this is what we can improve. As for Taiwan, we can update our telemedicine to telehealth, including clinical services and non-clinical services. And second, we can use telemedicine independently without integrating with local hospitals. As for the US, they can take action earlier, and second, they can use telemedicine to reduce unneeded visit and hire resources. Even though the pandemic threatened us worldwide, however, if we learn from each other, we can still fight against it. Thank you, everyone.
I'm especially impressed with your conclusion. Now I would like to get back to square one. Can you tell us the major differences between telehealth and telemedicine?
So telemedicine is like we open, like for example in Taiwan we open the line calls. We'll tell doctors like what you have a sore throat, you have sore that. However, the doctor cannot give the diagnosis directly. The only thing they can do is like collecting all your data or your symptoms, and then use another approach to integrate with the local hospital, which is bigger, and they can change like what's the similar symptoms, and then the only thing through the telemedicine in Taiwan we can do is to receive like a medicine sheet, and you can go to the pharmacy to get. However, if you use a telehealth, I've seen one. It's really cool. Is that like if you still open your FaceTiming, but you can think the doctor can feel like how much is the pain source, like how well or how bad, or some patient cannot just take really clearly. So I've seen one is that he told the patient to lay down on the floor and to check how much the rib go up and down to check its breath, so that they can know how much, how serious the patient problem is. Thank you.
I'm just curious if you see any sort of disadvantages to telehealth or telemedicine, such as ways that they could be inadequate or not as good compared to having the patient go in person, whereas maybe the doctors might misdiagnose the problem since they're just looking at them through the screen, or if you think there might even be an overflow of people just since it's so convenient to just go online, if that would mean that there'd be too many people trying to use this system.
For the first part, I think it definitely yes, because if you go to the clinic and the doctor can really see your throat or see your X-rays. So I would think that that's for sure, and that's how we need to still update. And the second part is that I would say no, because as in the US it's really expensive, so that not everybody can go to hospitals. So therefore there are some companies, and even I would say big companies, to hold this telehealth, and they even invented some apps or clothes or so like that. And there's really a lot of patients using telehealth because first it's too expensive. Second, America is so big, you can't just you're in the north and you can't just go back to your home to the south. But with the internet, you can just see through and you can get the diagnosis directly. Thank you.
My question, I actually have three questions. The first question is, who uses the health system most? The second is, does your grandmother use a computer? And third, do you see a connection between those two problems?
Can you repeat the first one?
All right, number one, who uses the health system most?
The first one is, I would say everybody.
Who uses it most?
Most, I would say between health givers, because that if, some, like for example, some old people, they cannot use the internet and they don't know how to use a computer.
Okay,
So,
point two, your grandmother, does she use the computer?
Very few.
Very little.
Yeah.
Okay, and number two, do you see a problem with that?
Yeah, because that elderly cannot use the telemedicine or telehealth by themselves. So I would say for accurate is that there are more people, the health providers using telemedicine or telehealth instead of the elders themselves, because they know more about the computer and they can understand more about what doctor is talking about.
So what you're saying is older people can't use this system
Yeah,
independently?
they can, but
They
the amount.
can or cannot?
Yeah, they can, but the amount is fewer than those in the 20 to 50 or 60. So that I did some research about for this part they just connect the telehealth to the health providers so that they don't miss the chances, because that's like heart rate or heart arrest, they can be really deadly. So with the telemedicine, they can just communicate with each other directly, and then the health providers can give the options or how to save the patient. So I would say that's a reason. Thank you.